Hi, I'm Megan, and welcome to Girl Talk. In this exciting news series, we're diving into the incredible journey of pregnancy, a time filled with joy, anticipation, and let's be honest, lots of questions. Over the next couple of episodes, we'll be joined by our expert, Prof. Manisha, who will help us navigate through this transformative time. We'll explore common experiences, debunk myths, and answer your burning questions about what to expect, starting with the all-important first trimester. This is just the beginning of our journey together, so be sure to tune in for part 2, where we'll continue to explore the ups and downs of pregnancy. Don't forget to like, subscribe, and share Girl Talk on all your favourite social media platforms. Now, let's get started and welcome our expert guest for today, Prof. Manisha. Clinical Associate Professor Manisha Mathur is the head of the Ambulatory Service and Senior Consultant at the Department of Obstetrics and Gynecology at the KK Women's and Children's Hospital. Having trained in India and the United Kingdom, she is a Fellow of the Royal College of Obstetrics and Gynecology and of the American Congress of Obstetrics and Gynecology. Professor Manisha is highly regarded as a caring, dedicated, and meticulous doctor whose main areas of interest are antenatal and peripartum care and medical education. In recognition of her service to her patients throughout the years, she was awarded the Sing Health Quality Service Gold Award in 2014, the Sing Health Quality Service Star Award in 2015, the Sing Health Quality Service Superstar Finalist winner in 2017, and the prestigious AMEI Golden Apple Award in 2019. She is also active in clinical research with many publications in peer-reviewed journals. So, hi Prof, thank you so much for your time and for coming in today.
All my pleasure. A lot of women have lots of questions, particularly the first-time moms. And I find that if we can provide, ways and means by which they can actually educate themselves, it'll be so much easier. Their journey becomes so much easier and less fearful for them.
Yeah, that's great. So, shall we dive into it then?
Yeah, sure. Why not?
Great. So I guess just as a very quick introduction, do you mind just bringing us through just an outline of the journey? What should I expect in pregnancy?
So, pregnancy is a long journey, lasts for 9 months, so-called, or 40 weeks. So 40 weeks is EDD, expected date of delivery is 40 weeks. But actually the baby is full term at 37 weeks. Lots of women actually don't understand that concept. So it's divided into trimesters. Trimester means 3 months. Okay, so essentially it's 12 weeks each. So the first 12 weeks is the first trimester, where the pregnancy journey begins and there are a lot of symptoms. And the second trimester is perhaps the easiest part of pregnancy. That's from week 12 to week 24. And where, a lot of new exciting things happen in the pregnancy. And then the last trimester is week 24 to 40.
Thank you for that, Prof. So now I guess if we zoom into the very first trimester, for any lady, say she's just tested positive for pregnancy, could you tell her, what am I supposed to do?
So if it depends whether there are any risk factors or not, essentially. So if it's a low risk, pregnancy in the sense, there are no worries or in terms of medical problems, etc., then, and if they've tested positive, then it's best to confirm the pregnancy with a healthcare provider. So sometimes people would go to their GPs or the polyclinics and confirm, the pregnancy test, usually by urine pregnancy test, sometimes by a blood test. What they would need to do is, if they are not already on folic acid, then they need to start folic acid. Because that's the main thing that they need. And if they have symptoms, then they could, obviously we need to treat them according to symptoms. And usually the polyclinic doctor or the GP, or sometimes the women themselves, will make appointment with an obstetrician to confirm the pregnancy by the way of scans. Because we like to date the pregnancy in the first trimester. So 2 or 3 weeks after the missed periods, we would assess, and if everything was fine, we would bring them back sort of end of first trimester, and that is when we would do all the investigations like the blood tests, which are the routine blood tests, and also talk about, the options, Down syndrome screening, etc., and do a dating scan to date the pregnancy, which gives the expected date of delivery.
Definitely. Well, thank you for that very comprehensive sort of like introduction into what they maybe should expect in their first few visits. So because this is such an overwhelming time, could we maybe just break it down a little bit, starting with this whole idea of dating the pregnancy?
Sure.
Could you maybe tell us a bit more about that? How does that work?
So usually, in the old days, pregnancy was dated from the last menstrual period. So we would ask the women, when was the first day of their last menstrual period?
Yeah.
Then to that day, we added 7 days and 9 months forward, and that would be the expected date of delivery. So that was traditional way of doing it. But there were many pitfalls for using this method. The main thing was that sometimes women didn't remember the period,
Right.
the first day of last period, some women. Sometimes their menses or the periods were not regular, and so that didn't help in dating the pregnancy accurately.
Right.
So the best way now to date the pregnancy is a scan in late first trimester between 9 weeks and 13 weeks, and we measure the baby. So we measure what we call as a crown rump length.
Right.
Okay. So that is from the head of the baby till the bottom of the baby, and that gives us the most accurate way of estimating the expected date of delivery, or
Right.
dating the pregnancy.
Right, and that would basically determine from their kind of their due dates and how
Correct.
they tell everybody how far along they
Yeah,
are.
that's right.
And what about this concept of the screening tests that you mentioned?
Yeah, so there are certain tests that we do in pregnancy, and they're best done again, in the late first trimester. So, firstly, we would do some routine blood tests. So that is just to check the general health and well-being of the mother.
Right.
So we would do a full blood count or the blood count to check for anemia. We also screen for thalassemia in our part of the world, because that's common. And sometimes it's both or either partner could be carriers.
Right.
Which is okay if only one partner is a carrier, because that's a silent disease
Yeah.
and people may not be aware. So we test both partners. The problem arises when both the partners are silent carriers. There's a small chance that the baby can have thalassemia major, which can have major consequences.
Right.
So that is why we would screen for thalassemia. If they already know their thalassemia status, then that test can be avoided.
Right.
Okay. Then we would check the blood group, because that has implications on how we manage the pregnancy,
Certainly.
and screen for antibodies in the blood. We also screen for certain infections. These include hepatitis B, HIV, syphilis, and rubella.
I
usually.
see.
So these would be the basic blood tests. But then there is also screening for Down syndrome.
Right.
This test is optional. That's not compulsory. And there are a number of options that the women can choose from.
Yeah.
Okay. So there are 3 main tests that we would do.
Okay.
So the first and the most established test is called the first trimester screen. I think in private sector in Singapore, it's the name given to it is Oscar.
Right. Okay.
So it includes blood test of the mother. So we do 2 hormones from the mum,
Okay.
which include PAP-A and beta-HCG, and then we scan the baby. So we scan the baby. Obviously, we look at the crown rump length, as we mentioned, look at the baby heartbeat. Then we would look at 2 main things. One is called the nuchal translucency, which is thickness at the back of the baby's neck.
Okay.
And also presence or absence of nasal bone.
Right.
Okay.
Okay.
So we use these parameters along with the mom's age and put it into an algorithm, which then gives us the risk. So mind you, these tests are screening tests. Okay? They are not confirmatory.
Right.
So they'll never be reported as yes or no or positive or negative. They are reported as 1 in something, like 1 in
Right.
5,000, 1 in 100, 1 in 10, and so on and so forth. So every center would have its own criteria for where they draw the line between high risk and low risk.
Right.
So
Okay.
most centers are anywhere between 1 in 200 to 300. Our center in our hospital, we use 1 in 300. But now there is another entity that's emerged in the last few years, which is called an intermediate risk.
Right.
So say 1 in 300 is high risk. That means 1 in 299 is higher than 300, because
Definitely.
it's less women, more risk.
Yeah.
Right? 1 in 10 is very high risk.
Yeah.
So between 1 in 301 to 1 in 1,000 is intermediate risk, where the women may or may not choose to do anything.
Okay.
Okay. So this test is very sensitive. Predictive value is about 90%.
Wow. Okay.
And the false positive rate is only 5%.
I see.
It's been there for many decades and is reasonably priced.
Right.
So it's quite popular. The newer kid on the block, the newer test is the NIPT, or the non-invasive prenatal testing.
Right.
So there are a number of names by which, so different companies provide this. So it could be Harmony, Panorama, IG,
Right.
NICE, etc. What it looks at, it's just mother's blood test, and it actually looks at free-floating fetal DNA in the mummy's blood. And with that, we are able to predict more accurately the risk of Down syndrome and 2 other, related syndrome.
Right.
The sensitivity for this test for Down syndrome is more than 99%.
Wow.
So it's more accurate, And this test can also predict, if the women opt for it, the sex of the baby.
Wow.
So that's, again, another reason. But however, mind you, it's more expensive.
Definitely.
Almost 3 times the cost of the
Wow.
first one, the FTS. The other test that's available is usually, done in the second trimester. It's called the maternal serum screening. It also involves scan of the baby and mother's blood test. But that test, the predictive value is not as good, 60 to 70%.
I see.
So that's why it's not so popular, and it's more common if the women have come late or they do opt not to do the NIPT, which can be done anytime from 10 weeks until later. Whereas this MSS is done only in the second trimester, and FTS between week 11 to week 14, essentially. Yeah.
Right, okay. So, I mean, in the 3 options that you've given us, we understand essentially that all of these are just screening tests.
Correct, yeah.
Should they come up with, say, an intermediate risk, as you mentioned earlier, are there sort of like, what is the next action that can be taken?
Women can then opt for, usually for intermediate risk, we would offer NIPT, which is non-invasive, because its predictive value is 99, more than 99%. So, which is fine. However, say the risk was much higher. So obviously they can still offer NIPT, but that's again a screening test, it's not confirmatory. So these women might be more suitable for an invasive test, which would be amniocentesis or a chorionic villus sampling, depending upon the gestation.
Right, and of course those definitive tests are also with their own higher risks.
So there's a small risk of transmission because it's an invasive test, so it's more worrying. Patients are more worried.
Yeah.
And they're scared of pain, they're scared of the procedure. Plus there's a procedure-associated risk of a miscarriage.
And, with the slew of options that's available for all of these mothers here in Singapore, in general, if one mother were to approach you and say, how should I choose, or which one should I choose, what's kind of your guiding principle for them?
So it depends upon the risk factors. So if there's anything in the history, for example, if there is any personal history, meaning having a child before with Down syndrome, or a family history, mother's age, or any other risk factor, then you would, discuss whether they wanted to do a confirmatory test from the very beginning, which is very small proportion of patients. Most patients would be, it's like a buffet choice for them, so they can choose. However, say a woman comes to me who's 40 years old, and she says, which test is best? So I would tell them that if you can do FTS, but if you do it, because age is a part of that formula, you're likely to fall in the high-risk category simply because that number is going to go into the calculations.
Right.
So whether they want to consider doing the FTS along with NIPT or NIPT on its own. Because you see, FTS has other advantages because it measures the nuchal translucency of the NT, that even if the risk for Down syndrome and the other syndromes, trisomies, is low, if that is high, then that can predict sometimes the probability of cardiac abnormalities in the baby. And in that case, we would arrange an extra scan for the baby's heart to be checked around 16 weeks.
I see.
So that has the added advantage. However, the predictive value is not as good as NIPT. So maybe in future we can find a formula.
Like a best of both worlds.
Correct, 100%.
Yeah, so thank you so much for that, Prof. I think, sometimes that area is always a little bit iffy and confusing for everybody. But so now that we've conquered this first consultation, now we just move on to a very quick section of some common do's and don'ts in the first trimester. Because I'm sure a lot of doctors and a lot of people in general give, expectant mothers a lot of instructions of things that they can and can't do. In general, if maybe you could start with, to say, taking vitamins. How would you advise your patients when they're pregnant?
So in the first trimester, the most important thing that I tell all my patients is not to take anything without checking with your doctor. So don't take any medications or even over-the-counter stuff. Because sometimes, they are not aware and they may consume things because babies, first trimester is most critical in terms of baby's organ formation.
Definitely.
And it's most vulnerable to damages.
Yeah.
So it's very, very important. So all they need, most of the women, would need only folic acid as a supplement for the baby's health and well-being. The reason is that folic acid, if optimal levels are present, it reduces the risk of neural tube defects in the baby.
Right. So that would be the brain development.
Yeah, correct.
Okay.
So that is what is needed in the first, 12 weeks.
Right.
After that, we usually would, depending upon the blood test, we would give them, multivitamins, fish oil, and calcium.
And in terms of that, you mentioned this whole idea of nausea and morning sickness. What is available to help mothers be a bit more comfortable in the first trimester?
So non-pharmacological interventions are there for mild, I guess, mild nausea, vomiting. So we would advise small, frequent meals rather than large meals.
Right.
Drinking enough. Some particular food stuff is better tolerated than the others, but no one sock fit all. So usually we would say dry toast, crackers, less oily, less spicy foods.
Right.
They don't need to worry so much about not gaining weight or even losing weight. A lot of women do actually lose weight in the first trimester or not put on enough, which is fine because baby's needs are very limited at that stage of pregnancy.
I see.
The other thing which I should have perhaps mentioned is ginger. So there are ginger tablets available over the counter, and some ginger with lemon. Some is also been shown to reduce the risk. Then there are other non-pharmacological interventions like acupressure and all, but those should be used with caution.
Okay.
Because sometimes there are risks attached to these as well.
I see. And in terms of what medications are available,
so there are actually first line, second line medications available. So the most common one we prescribe these days is called diclactin, that contains a medication that is safe.
Yeah.
The only issue with some of these medications is it makes the patients a little bit gives them drowsiness. So we usually advise them to take it at night.
I see.
And particularly the one I mentioned, the first line one, works for 24 hours. So there are options, and we would treat individuals depending upon the severity of the symptoms.
I see. And now moving on to some other do's and don'ts, perhaps maybe about general lifestyle measures now. Do you mind telling us a little bit, for example, in their day-to-day life, things like traveling? How was that during the first trimester?
So traveling day to day, as long as they feel fine, is all right.
Yep.
Like traveling in their car, traveling using MRT or the bus, that should be okay. It's the long distances which sometimes can present issues, particularly air travel. So there is, in the first trimester, there's a small risk of miscarriage with air travel. So we don't recommend non-essential travel.
Okay.
However, in the second or third trimester, they do, travel. But there are some risks with long flights.
Yeah.
So this risk includes clots forming in the legs and going up to the lungs. It's called deep vein thrombosis and venous thromboembolism. So what we suggest to circumvent that is that they should perhaps get up every maybe an hour or so and walk around.
Right.
Drink lots of water to stay well hydrated so their blood is thinner. They should be moving their legs even when they're sitting, and also wear compression stockings.
Right.
So it's not that it cannot be done or should not be done. There is a time and place, and it's good to take precautions.
Right.
The other thing that they would need when they are traveling is a fitness letter from their doctor.
Okay.
So they would need to have this letter. The doctor would do, check, make sure things are going fine, and then give them this advice, plus this letter certificate, which has to be submitted to the airlines.
Right.
And it has a validity of 7 to 10 days for most airlines.
I see. So just a green light for you to go.
Correct. And also there's a time period, for them where they can travel. So most airlines have a cutoff.
Right.
Obviously, they don't want babies being born while, high up in the sky, so that could create complications.
Yeah.
So, for example, some Singapore Airlines has a limit of 36 weeks, but there are some others who have 32 or 34 weeks. So my advice would be to check with your airlines you intend to travel and, plan accordingly.
Sure. Okay. And moving on to, say, another aspect of it, which is things like day-to-day activity levels, be it things like exercise or taking care of other children like toddlers.
Sure.
How would you advise your patients there?
So, I believe, and I always tell my patients that pregnancy is a physiological process. It's not a disease. Enjoy it, don't suffer it. Yeah. So, it's good to be active, but there are obviously, unless there is complication.
Right.
So suppose they have a risk of miscarriage or they're bleeding, then we don't recommend them to be very active. Okay, we don't expect them to be bedbound, but they shouldn't avoid. However, if everything's going well, then light to moderate activity or exercise is recommended.
Right.
At least about 30 to 60 minutes every day. So
Right, okay.
walking, swimming, pregnancy yoga, pregnancy Pilates are some of the things that women engage in.
Yeah.
But very heavy exercise or contact sports or exercise or activities that could put them at risk of injuries, falls, trips, those are the ones we don't recommend.
I see.
As for caring for toddlers, as long as, there's no correct answer. Some women feel tired, carrying if the toddler is heavy. So
Yeah.
what I recommend is do what you can within the limits of sensibility. Sit down and hold the baby, because it's not fair for the existing toddler as well.
Yeah.
But if you feel any discomfort or any other symptoms, then you have to maybe slow down a bit.
I see. Okay. And now I feel like I'm opening sort of a Pandora's box here, but the concept of food during pregnancy.
Oh God, yes.
Could you maybe give us maybe a just very quick outline first of,
Sure.
in the first trimester, what you avoid?
Obviously, the needs or the requirements during pregnancy are different from non-pregnant
Yeah.
status. There is, a weight gain in pregnancy. Average weight gain would be about maybe 11 to 16 kilos in women with normal body mass index.
Right.
So you do need to eat, and baby has its requirements as well. But in the first trimester, the needs are not that much. So women actually lose weight. But in the second and third trimester, they would need to add about 300 to 350 kilocalories extra.
Okay.
To just, and that's the requirement. So they're actually not strictly eating for two.
Right.
So that is important. So they will gain weight, and they should gain weight, but they shouldn't gain too much.
Right.
Because that's also not healthy.
Are there any specific types of foods that maybe they should avoid?
Yeah, actually there's quite a big list. So some of the things would include raw, uncooked fish. So for example, sushi, cold cuts of meat like ham, turkey, etc. Also soft cheeses. So cheeses like camembert, brie, ricotta, mozzarella. And also salad, a lot of vegetables, they should be properly washed.
Right.
And pre-cut salads should not be used. It's rather, it's fresh, and what is kept in the fridge should also be avoided if it's longer than 12 hours or so.
Right.
Again, because the bacteria, certain pregnant women are more vulnerable to infections. These include infection called listeria, which can increase the risk of miscarriage, preterm labor and stillbirth,
Right.
and also salmonella, which can make the women quite unwell during pregnancy.
I see.
So that is the reason why we ask women to avoid certain foodstuff. It goes without saying that no medications should be consumed without checking with
Definitely.
the doctor. And yes, there's also a matter of fish.
Right.
So, the fish that is, all fish contain some level of mercury. For the fish that is low in mercury, which includes most of the fish, including, but mind you, these fish should be well cooked.
Right.
Which means cooking at around 60 to 70 degrees.
Okay, which also means no sushi.
Correct. So these, most of the, the prawns, the oysters, everything else, all the fish, well-cooked fish, is usually low in mercury. And for them, if one portion is about 150 grams, it should be 2 to 3 portions per week for the fish low in mercury. For the ones that are high in mercury, such as shark, I think kingfish, etc., they should be one portion every fortnight.
I see.
So that's the difference.
Okay. What about like specific fruits now? In particular, in Singapore, there's always a talk about papaya and pineapples.
So, there's a lot of cultural and old wives' or grandmothers' tales behind this. So, for example, among the Chinese population, I believe pineapple is strictly forbidden.
Yeah.
So I actually looked into it, and I looked into some research papers, because I did wonder, like, okay, what does it actually do? So it does have something that can possibly, cause uterine contractions, but one has to consume 10 pineapples in a day for that to happen.
Okay.
So if it's a healthy pregnancy, and if you eat in moderation, which would usually be, maybe 100 grams or whatever, pineapples should be fine. So eat in moderation.
I see.
Same goes for papaya. I think among the Indian population, papaya is like strictly forbidden. So again, as long as you eat a small portion, it's fine.
I see. And moving into beverages now, things like caffeine and alcohol.
Yeah. So alcohol there's no safe limit in pregnancy. So essentially the guidance is no alcohol.
Yeah.
For caffeine, we usually follow the WHO guidelines. So there is small amount of caffeine which is considered okay, and that is about 200 milligrams of caffeine a day. It's not just caffeinated drinks; it's also chocolate, cola. You have to remember that they contain caffeine as well. So, for example, 100 grams bar of chocolate contains about 20 milligrams of caffeine.
Right.
A can of 375 ml can of cola contains about 40 milligrams of caffeine. A cup of tea contains 50 milligrams.
Wow. And just finally, Prof, do you mind if we just do a very quick rapid fire round of things and treatments, for example, that women can and can't get while they're pregnant? Sure. For example, let's start with doing my nails. How does that work in pregnancy?
So manicure is fine. Manicure and pedicure is fine as long as it's not gelish.
Right.
Because for gelish, it's some of the chemicals which are not recommended.
So the next section now then, things like hair. About hair coloring, hair perming, hair treatments.
The general advice is to avoid, dyeing of hair in the first trimester. And in second or third trimester, if women do dye their hair, then perhaps stick to vegetables, semi-permanent dyes.
Right.
Okay. And non-ammonia containing dyes.
Right.
So that's the general advice. However, there's not much research to support this view. It's more anecdotal.
Right.
The other thing that I came across in a paper was that highlights are better than coloring because it doesn't go to the roots.
I see. Okay.
Which was interesting.
A thing to note, maybe a new style for while you're pregnant.
Yeah, all the highlights.
And finally, I guess the whole thing about wellness, for example, going for spas, massages, even a hot tub and jacuzzi. How would you advise your patients regarding that?
I mean, it's very important to be happy. And I believe, going to spa and massages is fine. For massage, use pregnancy, accredited masseurs. Also, don't lie flat, absolutely flat, because if women after they are 20 weeks pregnant or 5 months pregnant, if they lie flat, there's a chance that they can get low blood pressure that leads to dizziness, etc. So it's good to be a little bit propped up or have veg on the side.
Okay.
But it's okay to have a massage. It's all right as long as it's gentle and they know what they're doing. So that's fine. As for the facials and all, that sort of treatment, it's usually considered okay as long as certain chemicals are avoided, which include mostly vitamin A containing products. So retinol, retinoids, isoretinoid, those sort of things should be avoided in pregnancy. Hot tub, jacuzzi, that's a question often asked. In pregnancy, the women's temperature is a little bit higher because of the hormones. And if you sit in the hot tub, your body temperature will rise, but the core temperature will be 1 degree higher.
Right, okay.
So usually they say avoid in the first trimester.
Okay.
In the second and third trimester, if you want to take a bath, then you should check the temperature. So use a thermometer to check the temperature. It should be lower than 38 degrees and not for more than 10 minutes.
Well, thank you so much, Prof, for covering that. Just as a quick conclusion and summary, as a mom yourself, what is your piece of advice to, mothers on pregnancy in general?
I think it's good to plan the pregnancy if possible. The reason is that it's good to optimize health. So that would mean, if women on certain medications which are not pregnancy safe, we would all change them.
Yeah.
To make it more safer, we would start them on preconception folic acid,
right,
which reduces the risk of a miscarriage. And maybe give them, reassure them and tell them what is the best time to come.
Yeah.
Give them enough information to plans. And as I've mentioned, that most pregnancies are low risk. As long as you're low risk, don't worry so much. See an obstetrician, get your pregnancy dated and scanned. Remember, it's a physiological process.
And have fun with it.
Indeed.
Well, so thank you very much, Prof. And I think that kind of wraps up sort of our first episode. So thank you so much for watching our first episode on the first trimester, where we cover a bit on what to expect in pregnancy, some normal things to expect in the consultation, as well as some do's and don'ts in terms of what you're supposed to do and not to do during pregnancy. Do stay tuned for our second episode, where Prof again will be covering the second trimester this time, and we'll see you on our next episode of Girl Talk. Hi, thanks for watching this episode of Girl Talk. If you enjoyed it, feel free to like, subscribe, favorite, and follow Girl Talk on all our social media platforms. We hope to see you on our next episode.